Hello, everyone. This is Mark Anthony with AI Edge Podcast, where we deliver the best of the best doctors in their area and in their niche. Today, we have a great title and a great doctor who is Dr. Jim Hankinson. He is a licensed chiropractor serving the Kirkwood and St. Louis, Missouri area for over 2 decades. He's a graduate of Logan College at Chiropractic. Dr. Jim has been helping patients of all ages, finding, of course, lasting relief from pain. If you want to move freely, you want to live a healthier life, you want to get out of pain. I don't care if you're struggling with neuropathy, frozen shoulder, and the doctors have told you, hey, you know what? All there is to cut you open. Before you do that, not saying there's not a time and a place for that, but before you do that, take a look at this non-invasive way that Dr. Jim Hankinson works with. Now, the title of this is SoftWave, how SoftWave changed his life and his practice. So thank you so much, Dr. Jim, for being here. Totally appreciate it.
Mark, you're welcome. It's good to be here.
Hey, no, awesome. Well, before we get into how SoftWave changed your life and your business, let's maybe get to know a little bit about you, how you got into basically wellness, helping people, go from pain to non-pain or better pain, where there's less pain, if
Right.
there's even a thing.
Well, it's a long story. It started back when I was 14 years old and got my first chiropractic adjustment. I was a pitcher and I couldn't turn my head, and my dad took me to a doc that got me feeling better in about 4 days. And then I was able to pitch in a tournament. And we won. So that's where my chiropractic history started, um, 42 years ago.
Winning.
Uh, Say that again? Yes. And then in my early 20s, I herniated a disc in my low back. And it was so bad I had pain going down my leg. I had to get a handicap sticker to walk to my classes. Nerve conduction test showed I had a huge bulge in my back. The MRI, everything was conclusive that it was a disc bulge. And I went in to see a surgeon. I was laying on his floor in his office, and he just walked in and looked at me laying on his floor and said, "When do you want to schedule surgery?" I said, "Do you want to talk about the MRI? Do you want to talk about what the findings were?" He's like, "Well, I see you're in pain. Let's go ahead and schedule the surgery." But I didn't even talk to the guy. Didn't do an exam on me, nothing. So I went back to the chiropractor, and within 6 weeks, I was out of pain and doing everything that I wanted to be doing again, playing softball, riding my motorcycle. And I thought, this is a great profession. Maybe I should really look into this. My brother was a student at Logan, and he called me and said, "You really need to do this. This is life changing." So I applied, got accepted, and that's where my story started and how it started.
You know what? That's unbelievable. And it's interesting. Mine's very close to that. Back in, I think it was 2001, many moons ago, I had a slip disc and I was out of work for a year. I was doing therapy, not getting better. It seemed like I was getting worse. And a lot of the audience out there knows that, you know how that is. A lot of you guys out there in therapy right now, and it just seems like it's getting worse. Well, I was going through the same thing. Went to doctor to doctor. They wanted to do surgery. I had a slip disc. It was really bad. And there was some numbness going on in my hands and my leg. And they're like, well, we could do this and we do that. I was like, no. My buddy said, why don't you see a chiropractor? I was like, what's a chiropractor going to do? He's going to adjust my back. It's going to make me all better again. I got a slip disc, dude. It's freaking bulging. Long story short, went to a chiropractor within 30 days. He gave me a routine. He adjusted me and I was no longer sleeping on the floor. I was sleeping on the bed. I was back to work. And this is one of the reasons why I do what I do, because a lot of people just think that, oh, he's a chiropractor. What's a chiropractor going to do? Well, what a lot of people don't know is that a lot of chiropractors, I'd say 95% of them, they are doing ongoing studying to focus on how to relieve inflammation. And this system that we're about to talk about, I'm not bragging about a system that I never tried. I actually worked with SoftWave and I was like, I saw immediate results. I was starting to have some numbness recently on my back, and honestly, it hasn't even. I only had two SoftWave shocks, and it literally shocked the pain away, and I haven't had it since. So tell us about this beautiful, a SoftWave, how what it's done for you, and how you came along, and how it kind of came into your life, and why you believe in it.
I've had a lot of traumas over my life: car accidents, motorcycle accidents, bicycle accidents. One of the accidents I was in, I blew a disc in my neck and I caused trauma to all the nerves in my shoulder. That was, again, when I was a teenager, but it didn't come to haunt me until many years later. So I have done an MRI to show I have a torn labrum and a torn supraspinatus muscle in my shoulder.
Mm.
I had weakness in my arm, couldn't sleep on my left side at all. I did 3 rounds of cortisone shots. I did several PRP injections, which is platelet-rich plasma, and that all helped a little bit, but I still couldn't sleep on my side. on the
Wow.
left side at all. So the surgeon that was doing the shots, we sat down. He's like, "Look, we're at a bypass here. You know, we have no other options. We can't keep giving you these cortisone shots. It's going to destroy the cartilage in your shoulder. Really, what we need to do is go in and fix your shoulder." I said, "What's that going to entail?" He's like, "Well, it's a pretty aggressive surgery, and you're going to be off work 6 to 9 months." And I was like, "Yo, I'm self-employed. How does that work?" And he's didn't really give an answer. I mean, I understand that it's not his job to give me an answer. So I just was dealing with it, and I was doing some research on different technologies that might be able to help with it. And I ran into Kyle Bowers. He's one of the national trainers for
Oh,
SoftWave.
yeah. I just
He's a
had him
great
last
guy.
week.
He's a great guy. So I called him and told him what my issue was, and he's like, "SoftWave will help." He's like, "It's not gonna fix it. It's gonna decrease inflammation, it's gonna decrease pain, increase your mobility, and increase blood supply up to 300%. So it's gonna really try and heal things from the inside out." And there's nobody around my area that has one. So I watched a couple videos of a plastic surgeon who had saved people from getting their feet amputated through
Wow.
SoftWave. And I could see that if it truly healed the tissue I could see that was damaged, it's got to help what's inside my shoulder. So I took a leap. It's a big leap. And I bought the machine in November of 2023. I did 10 treatments at the end of 2023, and I was able to sleep on my left side the whole night. And over the last 2 years, I've done maybe 10 or 12 follow up treatments. So my range of motion is full. I can sleep on my side. I'm back at the gym working out. Is the tear still there? I don't know. It's not medically necessary to do another MRI to check to see if it's still damaged because I don't have the pain. So they won't allow that to happen. So that's how I came across it. It's how it's changed my life personally. And I see the potential of what we do with this technology. So we brought it to the St. Louis region, and the amount of people that we have helped in the 2 years I've had it, almost 1,000 people in 2 years have been through my office for software therapy. And I'd say 95% plus see improvement.
Well, I mean, that's a big number.
It is. It's immense. I've been doing this for 25 years, and I have limitations on what chiropractic can do. And this is the first thing that I've come across in my career that I can tell people I can help you. Where 2 years
Wow.
ago I would have said, "I'm gonna have to send you to a surgeon, or I got to send you for injections or something because I'm limited on what I can do for you." Now I don't have those limitations.
That's amazing. It's funny. I always put myself in doctor's shoes. If I own that unit, I'll tell you the number one thing I would do. I would go to the biggest fair in my area, and I would literally say, "Come get a free, 5-minute evaluation and
Right.
watch your pain go down." And once it starts to go down, by the way, I'd be like, "Oh, here's my card. Let us take that to another level and
Yeah,
get
we
you
had
fully out of."
but knowledge is power. So if you don't know about it, you don't know it can help you. And we just got to get them in the door that first
Right.
time for our mapping out session, our discovery session. And almost everybody we do a treatment on, whether it's a knee, a hip, a shoulder, tendonitis in the elbow, plantar fasciitis, almost everybody gets up after that first treatment. It's like, holy cow, I can feel the difference already. That's how fast the change happens.
That's amazing. I'm not joking. A few years ago, I thought about starting my own practice and hire a nurse practitioner to do all the
Mhm.
information. I'm not joking. I actually still may even be up for the challenge because there's so many devices that are like software that do other things,
True.
and I believe that we haven't even hit. We've barely broken the cracker on what this what this machine can do and heal. I mean, you can tell me. I don't know if this is true, but whenever there's inflammation in an area where there's pain, that means that those cells are basically dormant,
They're definitely damaged and not working the way they need to be
but they could
working.
reappear, correct? By this system. Like, how does that
Yes.
work?
Well, the SoftWave uses I want to call it supersonic high frequency acoustic sound wave, penetrates into the body about 3,500 miles an hour, and it goes about 3 inches deep. So it hits the bone, activates dormant stem cells that are in the bone to help regenerate damaged tissue from the inside out. It'll decrease swelling, decrease pain, increase blood supply, increase the healing process.
Wow.
I mean, it's
So
very
what?
simple.
Okay. So what I hear you saying is that it actually can activate those dormant cells and make them alive again?
Yes.
Wow, it's interesting
Regenerating
because there's a
damaged
lot of
tissue.
people saying doctors out there I've heard say, "Well, hey, once the cell's dead, it's dead, man. It's gone. Let's just amputate."
Well, I've seen some magic. One of the videos I told you about from that orthopedic surgeon, not orthopedic surgeon, plastic surgeon in Georgia, he was called in to amputate this guy's lower leg. He was diabetic, stepped on a piece of glass, got infected, and he didn't know about it. When they went in and had to clean the wound out, it was about a 4 inch long part of the bottom of his foot that was gone, um, about an inch wide and an inch deep. It was a horrible wound, and several of his toes were black from poor blood supply. So this doctor, 15 weeks later, I have a comparison video or picture of what he looked like when he started treatment, and 15 weeks later, and all that dead tissue, all that gone tissue, everything that was cut out is back, and the tissue, the skin is almost completely healed. And he says in the video he had to amputate one of the guy's toes, and when he was in for a follow-up visit, he's like the toe didn't look right, so he took another X-ray, and the bone was growing back.
Stop.
Swear to God. And this is in a video from I can't remember his name right now, but he's a plastic surgeon in Georgia that has worked on. I think there's probably 15 cases in this video on Vimeo that I watched, and that's really what made my final decision to buy this machine. So
Wow.
yes, there's no tissue there, and it
Unbelievable.
regenerated enough that it healed the area.
What else have you seen this has helped with besides like neuropathy and stuff like that? Say people with frozen shoulder, tennis elbow, really bad knees. They're just like, oh my God, my knees are just in so much pain.
So the areas that I've worked on personally would be TMJ, in the TMJ for the joint, the jaw, cervical spine, lumbar spine, where there's just disc issues, shoulder issues with frozen shoulder, or tears in the shoulder, tater cuff tears, tennis elbow, golfer's elbow, plantar fasciitis, carpal tunnel, bad knees, bad hips. Like the lady we worked on yesterday had a
Right.
bursitis in her hip, and you barely touch her, and she was screaming. Called her today, and she says she's already seen improvement. So even I had not a cross country runner, a girl's doing a marathon, and she tore her hamstring muscle in the middle of treatment. So she came in, and we were pretty aggressive on her, and she was able to complete the marathon with no pain, and the hamstring healed.
Wow. Have you used on any of your family members?
I've used it on my wife on her plantar fasciitis, which has tremendously helped with her. And then I have a son that he's 27, has a really bad bunion on his foot. So when he runs or walks, it creates pain in the bunion. So we
Right.
did his foot, and he gets about 10 days relief. And he lives about 2.5 hours from me. So the only time I can do it is when he comes back home. So it's not a lot of consistency with his treatment, but he absolutely gets relief from working on his bunion.
I can see you working on that. You're like, all right, son, you're only here once in a blue moon. We're gonna put this on high volume over here, okay?
Absolutely. Well,
Yeah, if you don't feel the pain, it's not working.
Well, unfortunately, that's true. The way I tell my patients, "Look, if you don't feel it, it's not gonna heal it." And they're
Wow.
like, "What?" I'm like, "There's gonna be a little bit of discomfort with this, somewhere between a pain level of a 4 and a 6. When you feel it, that's where it tells me the damaged tissue is at. That's why we do that mapping out session, so in future sessions, we don't waste any soft waves on areas that aren't problematic.
Mhm.
We wanna focus really on the problem areas.
Wow. And what have you seen this work on that you were shocked on maybe the results or you were like, "Wow, I just thought I'd give it a shot. I didn't think this was gonna work, but it actually worked."
Well, I will tell you that the things that I see that impress me the most are bad knees and bad shoulders. We had a guy last year that came in and couldn't raise his arm out to the side or in front of him, maybe 60 degrees. And after just doing one treatment, he raised his arm up all the way to the side in front of him, and he started cracking up. And I
No
said,
way.
"What are you laughing for?" He's like, "I've been in PT for a year, and I never got this much range of motion, and you did this in one treatment." I'm like, "Yes, it's the power of this technology, this machine." And then you know what? He quit coming in. The one visit, he's like, "I'm gonna go back to PT." I'm like, "You just told me you didn't see any results in a year compared to what I did in one session with you."
I hope you got a video testimony on that one.
Well, I took a video before we did the treatment and after the treatment, and I have the video, but he just didn't want to do any care. I don't know if it was the frequency that he was coming in. I don't know. But and the other one that really just impressed the heck out of me was a 90-year-old lady that was on bone in her knee, and the surgeon wanted to replace her knee. And I'm like, "You're 90 years old. Really think about this." So we did SoftWave on her, a full program on her, and that was about 18 months ago. I followed up on her. She said she still doesn't have any pain.
About how many, I know everyone's different, but
Mhm.
how many, times did she come in to get help?
She came in an original mapping out session, and then she came in an additional 10 sessions after that, and she started out at a pain level 8, and she left at a 1. So and that's over when we do treatments, we do typically 2 times a week for 2 weeks, and then 1 time a week for 4 weeks, then we do 2 follow-up sessions that are about a month apart.
Unbelievable, man.
Yep.
Wow. So you've been with this almost 3 years.
And we got the machine in November of 2023, so we just had our 2-year anniversary. We're at, 24, 27 months now.
I bet you get a lot of referrals.
Not as many as I would like. I've been to, from patients, we get a fair amount. but I've been to orthopedic surgeons' offices, pain management doctors' offices, my own primary doctor.
Mhm.
And I'm like, look, we have this technology that is life changing. No referrals from the medical world at all.
You
That's
know,
just
if I
my
was in
experience here in St. Louis. I know other
wow.
doctors are doing better with that, but we haven't had that response yet.
Interesting, my brain I'm always into the psychology of it. I'm thinking, like, once they're all happy, I'm like, "Well, I'll tell you what, I would recommend some continuation, but if you bring one person in, it gives you this many."
Well, I had one ortho that he had given me shots in my shoulder and my knee before, and I went in and talked to him and gave him the brochure. I was sitting there talking to him. He's like, "So, what's the end game for this?" I'm like, "To prevent people from having surgery and help them." And he looked at me. He's like, "So you're gonna take my business from me?" I just like looked at him. I'm like, "The whole purpose of your profession, my profession, is to get people better as quickly as we can with the least invasive techniques we can."
And
And
that was the wrong thing to say.
yeah, I just didn't even
How
want to say
much
it. So we're not on the same page. Thank you. And here's my brochure, but I know you're not going to refer anybody to me. I was really stunned.
it's just weird. I feel like people go into not saying all doctors, but come in with helping people. And then what happens is they sign on the dotted line, the contract, and they're only limited to do only what they're told. That's why I love, doctors like yourself that own their own practice. They can focus on the healing, focus on where is the root. Because most of the time when you go to a doctor's office, it's like, oh, you're in pain. Oh, it's right there. Okay, okay, okay. Well, what we can do surgery. So it's like if I go to someone that does surgery, that's all they know. Let's
Right.
do surgery. So I'm not bagging on them per se, but it's like I would feel more comfortable if I was a doctor knowing, wait a minute, I'm going to find the root of this problem and to focus on healing it. I mean, I
Right.
don't know. It's common sense to me, but I guess sometimes money gets in the way and sometimes changes people. No pun intended.
Yep. And it's the same way with this chiropractic care. I've had many patients over the years that see improvement with whether we're adjusting their neck or their low back. And they're like, well, my primary doctor wants me to go see an orthopedic. I'm like, that's fine. You can go ahead and do that, but you're improving. And if you go see a surgeon, what is the end result with the surgeon? They're like, what do you mean? I'm like, what do surgeons do? They do
Thank you.
surgery. So if I'm getting you better without that, wouldn't you want to continue this? And I've lost tons and tons of patients over the years because they went to their orthopedic and their medical doctor and like, oh, well, that's not best for you. We need to put you on PT or put you on prescription medications to control the pain.
I
Like,
love it. I love it. I always think if I was a doctor or if I was in that person's shoes, if I was explaining that to them, I'd have a nice pair of scissors right next to me. And I go, this is what they do. Okay. Now, I'm not saying you shouldn't do that, but if your inflammation's going down, don't you think it'd be better to continue to do what's working, Miss Jones?
yes,
Let them out of their mouth. Yes, I do. Well, why would you think that would work? Because what I've learned about psychology with people, it has to come out of their mouth. I need help. If they don't say it and they just, no,
right.
you have to get them to say it
Get them
because
through knowledge.
we're trying to help them. Help me. Remember the Jerry Maguire? Help me help you. That's what you're doing is help me help you. If I were you, I'll tell you what I would do. You already know I love pickleball.
Yep.
Brother, my friend, you like pickleball now. And I'll tell you why you will like pickleball and you'll learn to love it. Number one, 95% of the pickleball players on the court are wearing a strap on their knee and on their elbow. And guess what they're doing? They're making it worse because they're like, well, I'm getting older. I'm going to get through it. No. See, if you were there playing and you see the strap, hey man, how long's your pain been helping you? Been not helping you, hurting you. They're gonna tell you, "Well, I can get that I can get that lower." What would you say from 1 to 10? You're from 10 to 1, 10 being high pain. I'm about an 8.5. What if I can get it to 2.5? Oh, I'd give you a check right now. What I'm trying to tell you, start playing pickleball, man. Do the
Right.
indoor pickleball courts, join the clubs. You will be so full of people, freaking pitiful. They will know you
Right.
as you know what I would coin myself there and start wearing shirts, not promoting the practice, but promoting you. You got your last name on the back and on the front. I fix tennis elbow or I fix pickleball elbow. And
That's good.
then on the back, ask me how. My
Yep.
point I'm trying to tell you, you will be so full of people. And I know we're going on a different rant, but I'm focused on let's help as many people as we can because you have a product that's helping people, that's healing people. I mean, you will be so slammed. You'll come back to me I'll give it 2 weeks. In 2 weeks, you'll come back to me, Mark, on another podcast show. You're right, dude. I go, I know I was right because if I was a doctor where I'm at, all I hear is my tennis elbow, my tennis elbow. I'm not even joking. So I see in your future some pickleball.
Okay.
It sounds funny,
No,
but
it
these
doesn't, because
people are cracked out and they're playing in pain, but they don't know that they got you, man.
they don't have options. I used to have shirts in an old office I had that said "Got pain" in the front of it, and on the bottom, "We can help." And for some reason, I got rid of the shirts. I stopped getting them to
Well,
print it up.
I would do it to where it's on your back and on your front. I would put tennis, pickleball elbow, knee pain. I can heal it within. I can make you feel better from 1 to 2 or something like that, and then have it on the back too. Because when you're playing with your partners, they can see your back when they're serving.
Yep.
I'm just saying, like you're going to see 95% of the people that are real players. They're going to have their little rubber band on their elbow and on their knee. So I'm just saying these guys will pay money all day because I played last night. I called my friend up. I was like, "Are you going to come out?" He goes, "Oh, dude, my tennis elbow is just killing me, man." Because all they're doing is ice. By the way,
Right, and that's not enough.
that's not enough. So
No.
I can't wait to get back with you and talk with you to see how about your pickleball.
Right, and most people don't understand that, tendinitis is an overuse syndrome. So when I tell people you may need to back off of playing golf or playing pickleball, they look at me like I'm on crack.
Yeah,
Like, well, this is what's causing the problem. So we need to ice, we need to work the muscles out, we need to do SoftWave, and you do need to back off just a little bit to get just to heal a little bit. But that doesn't go over very well.
no, it doesn't. Pickleball people are a little bit easier because we play 5 to 6 days a week. Like
That's a lot.
I'm actually gonna in about 2 hours, I'm gonna go drill for about an hour with my son. He's trying to go pro, and then I play at night from 7 p.m. to 8:45 until the lights shut off. So I'm just saying that these addicts are out there, and the hot day for pickleball for people that are in pain are Saturday mornings at 9:45 a.m.
You
They
got
will
that
be
down.
they will be packed. Go out there, have a little chair because 'cause they're gonna have chairs out there depending where you're at, and just kinda hang out, talk with people, and then what happens is they do round robin, so you're able to play with everybody.
That'd be
You're
fun.
able to play with so many people. Anyways, I'm getting excited because I was like, "Dude, you've got like a gold mine in your backyard of pickleball players."
True, and we have probably half a dozen, if not a dozen, pickleball places in the St. Louis region. Some of them, one of them has 45 courts inside of it.
Dude,
Yeah,
I mean, just hang out right there, you know? But anyways, yeah, this is awesome. Yeah. So what would you say to somebody that is looking at maybe getting surgery and they've just kind of given up and they haven't heard about SoftWave?
I would tell them, look, you've exhausted all of your options. If you're really looking at surgery, try one more thing, see what it helps. If it can heal the area, fantastic. We'll know pretty quickly if this is going to help. Within, I'd say 90 seconds, we're going to be able to determine whether SoftWave is going to help to decrease inflammation, decrease pain. So try something, one more thing before you go that route of surgery. What do you have to lose? Whether you,
You have
and
nothing to lose.
I'd say part of the downfall is I'm in a chiropractic office. That's what we do. So when people see SoftWave and they come in, they're like, "Oh, it's another chiropractor." It's not the same thing. Chiropractic is completely different from SoftWave therapy. I don't adjust people who come in with a bad shoulder or bad knee. It's strictly SoftWave. Give it a try. You won't be sorry.
How does it look? So let's say I go in your office. Run me through how it would look for me to sign up with you if I did have knee pain and I
Sure.
wanted
So
to possibly get into SoftWave.
okay, so the first thing is you call the office. We have some online Facebook and Instagram ads. You can sign up that way. We have you come in, fill some paperwork out. We take you back, do a consultation on you of how long this has been a problem. What have you done in the past for it? What are you currently doing for it? We'll do an examination on your knee and potentially take some x-rays if we don't know what's going on. We have x-ray on site. And then we'll do the treatment. And treatment's about 5 minutes long. We use 500 soft waves on the knee. Have the patient get up and walk around my table before I do the treatment on them. And then I get up and have them walk around again after the treatment's been done. Like, tell me how it feels. Does it feel lighter? Does it feel like there's more motion in your knee? Is the pain less? And almost every single time it's a yes.
Wow. So do you normally do like bundle packages? Does it normally start in like fives or tens, or does it just depend on the person?
It really depends on the person, but the packages we typically do are either 8 or 10 sessions.
Okay. And does insurance cover that or?
No, at this point, insurance doesn't cover SoftWave at all.
Okay.
But you can use like an HSA or um, HSA or can't remember the other name of the card, FSA or a HSA card. You can use that, and we just give you the documentation or the receipt you need so you can submit it to the company if they have any questions. But typically, it's just an out-of-pocket expense.
Okay, that sounds good. And so right now, would you say 75% of your clientele is chiropractic, or would you say 20% is like neuropathy, SoftWave?
I'd say that 60% of my practice right now is chiropractic care. 40% is soft wave, and it's growing. My soft wave, on some days, I see more soft wave people than I do chiropractic people.
Wow. So
Yeah, which
it's
I'm
getting up there,
completely
and it's
fine
only
with
been a
that.
couple years.
Yeah, and it's amazing. Again, when I see people come in who are to the point they're almost in tears because they have no other options, and we do this, and they just see changes. The doctor I have on staff with me, Dr. Joshua, he treated a woman a couple weeks ago that broke down in tears and started crying because the range of motion change after one session was so immediate that she just started bawling.
Wow.
Yeah, because she was left with no other options.
That's amazing. I still can't get over the story of you talking with one of the doctors saying, "Well, how am I going to make money? You're going to take my clients."
It's,
What did you tell him? Did you tell him, "Well, I mean, we're in the business of healing people, right?"
Well, I did. I told him. I said, "Look, I got in chiropractic to help people. You got into to be an orthopedic surgeon to help people. We go about it different routes. It doesn't matter how we get there. That's our goal is to help people as much as we can with the least invasive techniques we can." And I just told him, I said, "We're not on the same page here." I said, "Here's my brochure. If you find somebody that you think that this may help, I'd appreciate the referral." And I just left. I mean, I didn't know what else to say.
Well, I have one more question. When you are working with people that have, or have you worked with people, say with like type 2 diabetes and stuff like that, where they're just always having that, where they're not feeling certain parts of their foot, what would you say from 1 to 10 of the type of people that you've helped and you've seen them get better with able to start to feel again?
So, in the 2 years I've had this, we've treated about 6 people with neuropathy. It's not
Okay.
a ton, but each one we have worked on has gotten some sensation back in their feet. It's somewhere between, I'd say 20% improvement up to 80% improvement. It just
That's
depends
good.
on a lot of different factors. So when we do soft wave on neuropathy patients, we do their low back, and we do the bottoms of their feet, the lower part of their calf, and around their ankle area to increase blood supply. We also have red light therapy on site that we use for that, and a vibration plate that we use to increase sensation and blood supply down to the feet.
Oh, wow. Okay, that's good to know because there's so many people out there that are struggling with that type of neuropathy
There
because
are.
of diabetes, and of course, I know that you start to help them get on a better eating list,
Yep,
diet.
it's type 1. Type 1 because your pancreas isn't working very well. Type 2 is typically lifestyle choices, bad diet, lack of exercise. And every one of my patients that has come in for that has been type 2. I haven't treated a type 1 patient yet. And they're all obese. They all have crappy diets. None of them exercise. So we try, just counseling them as much as we can to say these types of lifestyle changes are going to benefit you and to not expect an overnight change. You don't get obese overnight. It takes time. So to expect that by changing lifestyle, by eating healthier, by exercising, it may take months and months to get the weight off. But by doing that, it's making your body work even better.
And able to feel again.
Yes. And that's the important part of able to feel your feet.
100%. We live in a time where people want something quick. Give me
Absolutely.
a pill, it's gonna be fast, and not realizing there's a repercussion with fast, just like fast
Yes.
foods is a repercussion. I know whenever I eat it, I'm like, I fall right to sleep because my body's like, "What are you doing, bro?
Right.
You're eating good, and all of a sudden you're putting a chemical hamburger in your diet."
Yep. So it's not it this your body doesn't respond to sometimes gluten, wheat, yeast, sugar. Your bodies don't deal well with it all the time.
100%. It's sad that we live in a country like that right now. It's become the norm, and we wonder why
Yeah,
we have the
I think
highest.
60% of the country, I think it's over 60% of the country is considered obese right now. That's ridiculous.
Yeah, if you look at pictures from I'm sure you've seen it, everybody has. If you're on social media, they show the beaches of back in the '70s.
But yeah, everybody's thin.
Uh-huh. Yeah, now
Yep.
it's just like, "Whoa, okay, that's a movie,"
Yeah,
you
right.
know? But
It's so much easier and cheaper. You can take a family of 4 to McDonald's and get out of there for $30. That's cheap. Is it good, healthy food? Not at all. It's cheap, and you can afford it if you're on a fixed income. I
yeah, I don't know
understand
about
it to
30
an
bucks. I
extent.
mean, remember we got the Build Back Better program, so that's like $50.
Yeah.
So Nowadays, I think Happy Meal, like, a few years ago was like $3, now it's like $10. You're lucky if you get even uh, a full size, drink, but that's another podcast.
True. It's
Dr. Jim, thank you so much for being here. I appreciate it. And those of you that are looking at, maybe you're going through diabetes and you're struggling with filling your feet and you're not getting enough blood flow. This system helps with blood flow. This system will help out with frozen shoulder, tennis elbow, pickleball elbow, knee pain. I don't even care if you got pinky toe pain, guys. This will help. Period. Why I go quick to get an operation when you can try this? You don't want to have that in the back of your mind. Well, I wish I would have done this. I mean, this is not expensive, guys. It really isn't. Yes, insurance doesn't cover it, but let's just think about it. Let's just use this for a second. Most insurances don't cover stuff that really works that well. Think about
absolutely.
that. They're going to give you a pill to give you another pill to give you another pill so they can make their money keeping you in bondage. And guess what? I can say this because I'm not a doctor. And that's why I do this show, because these doctors like Dr. Jim, his focus is finding the root cause. And if we can find the root cause, we can help heal you. Those of you that would like to talk with Dr. Jim, those of you that would like to find his website, you can go to stlbackdoc.com. That's stlbackdoc.com. You can also call the phone number on the screen. And if you have any last words to say to the world out in social media land, go for it.
My goal is just help people get better, one soft wave at a time, one adjustment at a time. I want to change lives, improve the quality of your lives so we can extend the amount of time we're here on this planet.
I love it. And you guys heard it from the doctor's mouth. Pickleball players, come see the doc. It'll
Absolutely.
help you. Matter of fact, I'm going to go see the guy. I'm a little far from Dr. Jim, or else I'd be there in 5 minutes. But I'm in California right now currently. But I'm going to be hitting the coast this week. And I'm going to get this taken care of right away because playing in pain is no fun. So God
No
bless you
problem.
all. And remember, sharing is caring. One video can change one person's life. Let's help people. Let's get the word out there. God bless you all. And thank you, Dr. Jim.
Thank you, Mark.